Join us every Wednesday for InFocus, a weekly talk show produced by the SKNIS Information Service, where we provide exclusives with key persons within the government and discuss pertinent, relevant, and interesting matters that affect us all. Tune in every Wednesday, live on ZIZ Radio and streamed live on Facebook at SKNIS Media and ZIZ Online. InFocus, your government, your business.
I'm Ian Richards, welcoming you to InFocus, a weekly program where we take a closer look at what's happening within and across the government of St. Kitts and Nevis, your government. Today, we close out the 2025 season of InFocus with a deep dive into the nation's healthcare system, its progress, challenges, and major upgrades now reshaping how care is delivered across St. Kitts and Nevis. We'll discuss the impact of the commissioning of 5 new ambulances, the recruitment of professional nurses from Ghana, and the latest on the new Climate Smart Hospital and St. Peter's Polyclinic project. Joining us are Permanent Secretary within the Ministry of Health, Curtis Martin, and the Director of Health Institutions, Dr. Jenson Morton. Stay with us as we focus on the strong pulse within the Ministry of Health.
If you haven't done it as yet, please do it today. Subscribe to our YouTube page at SKNIS Media for regular updates, live coverage, and even more information on your government. While you're at it, like, share, and interact with our Facebook and Instagram pages at SKNIS Media and SKNIS Info.
Thanks for staying with us and allow me to welcome back to InFocus the Permanent Secretary within the Ministry of Health, Curtis Martin, and also Dr. Jenson Morton, who's the Director of Health Institutions within the Ministry of Health. Gentlemen, welcome back.
Good afternoon. Good afternoon. Thank you very much. We are delighted to be here. We are very happy to receive your call asking us to be the final episode for 2025. And we're happy to share the health and wellness of our ministry.
And there's so much to get into, PS, and so we're going to jump right into it because, as I mentioned, there's a lot of topics that I would like to get covered. And we can probably start with the commissioning of the new ambulances. Of course, that is something that was much talked about, the need for emergency medical transport. So it was commissioned back, they were commissioned back in late October. Now, I want to go back to the commissioning ceremony and quote some statistics shared by Chief Medical Officer Dr. Hazel Laws. She shared that the ambulance services responded to over 1,600 emergency calls from January to September. I'll repeat that number. 1,600 emergency calls from January to September 2025. What does this number say about the current demand for emergency medical care?
Okay. Well, I would have to begin by saying that the number of 1,600 that actually refers to the amount of times that the ambulance was called, that they went to someone's house to respond to a call, and that they came back to the hospital with a patient. So the number is even higher when you factor in the times when they went to a scene and they were able to assist the person on the scene without needing to bring them back. And it's even more when you consider calls that came in which the dispatcher was able to help the person over the phone. So it's a lot of work that's done by the emergency medicine technicians. Now back to the 1,600, that number lets the Federation know how much we need to have a high-class, up-to-date, efficient, functioning ambulance system. And that is something that has been one of the challenges that we entered and met, and one of the things that we've been actively trying to improve. It's multiple things. The ambulances, the actual vehicles, that's one part of it. And then the human resource part is the other aspect of it, which we've been tackling the entire time simultaneously. So the addition of the 5 new ambulances, it's been very good. These vehicles, of course, when you have we had 2 ambulances that joined our fleet since May of this year.
Refurbished.
These were refurbished ambulances, and they actually have been performing their duties very well. But the 5 new ones, the little advantage that you have when one is new is that you are ensured that you're going to get more out of it based on the fact that it's not coming with any previous mileage. The other thing was that a lot of work went into the selection of the vehicles. We specifically chose vehicles that were on the smaller side for a specific reason, such that all of the nation's roads and byways can be accessed without difficulty. We further ensured that the vehicle type, we went via TDC, and the Toyota vehicle type, if one was to look at the overall make of the ambulance, you'd be able to tell that its chassis is very similar to what we call the 14-seater Toyota passenger buses. The reason for that is that the internal engine works and mechanisms, etc., it's the exact same.
Right.
So because we have so many of those buses already on island, the persons at TDC, they are very much accustomed to the repair of those vehicles. And TDC was contracted specifically to do the maintenance of these vehicles in a regular fashion to ensure that we get as much out of them as possible. And furthermore, we also made sure that we made our own modifications to the ambulances after they came to ensure that they could be equipped with every single thing that's unique to the St. Kitts Nevis context with regards to the types of calls that we respond to and some things that we would have to put in on our own. Our own on-island local persons via TDC and other workmen on the island actually responded to that.
So the ambulances were custom built, as you mentioned,
Yes.
And it was designed to meet the needs of the local staff, not
Yes.
just the local conditions in terms of roads, but also the needs, as you mentioned just now, in terms of the local staff, the emergency crews that is
Yes.
manning it. So how has it really impacted the work of the emergency crews that are on those ambulances and responding to calls?
Well, it's been relatively new, and they have been pleased with the service. I've been asking them on a daily basis if everything's been okay, and they've been giving them good reviews. We are trying to ensure that whatever concern that staff members raise in the hospital, that we take them seriously and we try to address them in a timely manner. And with regards to the ambulances, I have to say that they seem like they have been happy with the improvement in the vehicles that they have to use now. So,
Happy with the improvement of the vehicles that have to use. What about happiness in terms of the times of the response? Because that, of course, is a big concern by persons. If you call the ambulance, I mean, persons would like them to be there. In a timely matter, you're talking about life and death.
Yes.
How has that been?
well, we have not had any complaints with regards to the timing. For that one, I would speak not just to the staff, but also to the general public. We have not had any complaints with regards to the timing for quite a number of days since we would have started using the new ambulances. The vehicles are just one part of it. It just ensures that there is an actual automobile that is present that can go for them. But surprisingly, the factor that impacts most strongly the rate of response is actually factors regarding the human resources aspect of it, meaning how many crews might be available at that particular point in time when the emergency is called in. Because of the limitations of our population, we would have sometimes one crew or sometimes two crews in the Bastia area. And if it just is that they have left for two other calls at that time that are of a higher level of emergency, that is something that could prolong their response to another emergency. Normally, if they're en route to something that is deemed to not be as urgent or emergent, and another call comes in for something more urgent or emergent based on the description, they may have to reroute to address that one more quickly, since that's more life and death. And then that person that would have called earlier, they might end up having a slightly longer wait. Those are the things that tend to impact the wait. What we've been doing is we've been equipping our dispatching crews such that if the persons call back to have complaints, and this is something that they have also been doing on their own, but if someone calls back with a complaint, that they can actually give advice over the phone in the interim whilst the ambulance is coming, because that person would know approximately how far the vehicles are. Now, the other thing that we've done is we have equipped equipped or equipping. I think we're in the process, of equipping the ambulances with the proper GPS tracking such that that same dispatch crew can know exactly where the ambulance is. Ultimately, we want to work with a combination of Taiwan as well as our own IT specialists to develop an island-wide GPS system that all citizens can access such that if they call in an emergency, they can send their location and the ambulance can find them rather than the descriptions. That is one of the things that's a component of the health digitization journey that we have embarked upon. It's one of multiple paths of that digitization journey. But when that becomes fully functional, it will help us a lot since, we have issues with street numbering and naming. But I think the Department of
Technology, they're working on that.
The department to do the street naming. Pardon? GIS. Yes, the GIS. I think they are working on ensuring that all of our streets are named and numbered, because when emergencies happen, it's very important that they get those specifics.
Right, and there's a project that also the minister responsible for public infrastructure, the Honorable Congress Mayor, has spoke about in terms of ensuring that with the postal system as well too, that you don't just give a direction by the mango tree, turn left and right. So that's very important, and also with the GPS as well too, because I can tell you, I recently was traveling to pick up someone at the water taxi ferry over at Reggae Beach, and I used Google Maps, and I wouldn't tell you, it sent me somewhere where I got lost. You're completely lost.
Sorry about that.
It wasn't too far away, fortunately, and so I was able to get some advice. But that GPS component is very important as well to PS.
But I think as well, I think what's key for us is the management of the data that we receive. So we're working on not just the ambulances in terms of their effectiveness, but we're working in terms of the type of data that we receive to see how we can respond in a better way to the public. And so for next year, we'll be consolidating on customer service, staff development, and training, and also our key performance indicators. So that will be across the ministry. So we expect to, because for example, every month, the Honourable Prime Minister and Minister of Health, Honourable Dr. Terence Drew, he comes to the ministry every month to go through the statistics across the ministry, and from that we're able to seek a strategy as to how we're going to do certain things, and that's been working very well. So his support has been solid in that way.
Right. Next time it would be good to get some of those statistics as well, so that we can share with the public.
Well, I can assure you that early in the new year, our public relations officer, Mrs. Siobhan Richards, she would actually bring Dr. Laws and Dr. Isles here, who would then speak to those numbers.
Right. And of course on other programs.
And other programs, of course. Just call us. In fact, we'll call you.
Right. So just back to the ambulance in terms of, as you mentioned, manpower, the human resource is very important. Will we see an increase in terms of staffing? Are we going to have more persons trained?
Actually, we recently had an increase in staffing. We would have trained 11 new EMTs to reach the level of EMT basic, and their training would have been completed in March, and they would have been formally added to the staff in May of this year. And that injection of new talent, it's already assisted with regards to the overall performance of the EMT service. But not just that, we have been linking with Dr. Kayla Maloney. She is a Kititian by birth. She lives and works in the USA, but she is an emergency medicine specialist. She has prepared a package that we are currently reviewing for assisting us with training of the EMTs in various ways. EMT basic overview training, aspects of the continuous medical education, advancing to EMT intermediate level, advancing to the degree level, which is the paramedic level, as well as certification in dispatching to even improve the aspect of being able to respond to calls if your child just got poisoned with something and you just want some advice over the phone as something's coming. So all of those things are being worked on for the new year in conjunction with the recent addition to the staff, 2 of them. One is Dr. Jason Eiffel, who is an emergency medicine specialist specific to the emergency room. And the second one, the most recent one, is Dr. Jonathan Carthy, who's actually from St. Kitts. Dr. Carthy, he trained in Cuba's program, which is actually a cross of the intensive care with emergency medicine. That's the way in which Cuba does it. So Dr. Carthy has already come on board to really helped to transform the EMT part, whilst Dr. Eiffel, he's working on the overview and he's focusing more on the physicians in the emergency room, but everyone works in tandem, everyone works together. Dr. Carlton Williams, who works in the emergency room as the doctor in charge of the emergency room, he also has taken a strong, he's agreed to take a strong stance with regards to assisting the EMTs. So everyone's going to be working together, and that's separate and apart from the EMTs in-house. Some of the EMTs that we've had, they have 15, 20 plus years experience, and we have some of them in roles that are supervisory, some of them in roles that are, supervisory. And those persons, they also come into effect with regards to the management of the EMT service.
I have been impressed by the use of persons from the diaspora who have stepped forward and are giving back and shaping policies and programs throughout, in particular the Ministry of Health. That has been very important in upgrading standards here.
And we appreciate it so much. Yes.
Okay. So as we speak about staffing, now the Prime Minister at the round the table that was held recently, he also mentioned that moving away from the ambulance schools, but also to JNF itself and the healthcare system, that a cohort of professional nurses from Ghana, they're being recruited. Tell us a bit about that.
Well, as you're aware, the world has shifted its focus in so many ways, and with respect to nursing in particular, I should add that that's a profession that is under some stress because of the shortage around the world. And so we always have to seek avenues. Here in St. Kitts and Nevis, we have been doing a number of things, before I get to the Ghana situation quickly, a number of things to build up our nursing capabilities and capacities here. So we've had a number of nurses who would have been specialized and returned to the Federation, and some are also out in specialized field, ICU and others.
They're out for training.
Out for training, and we have some who have returned, right? We also provided an entry-level maths and English pre-course requirement that would help those, because that was one of the barriers. We have the nursing assistants and nursing attendance program. We also have the registered nursing program and other programs. So we've been building that up. And we also have, before the Attorney General's office, a policy to do the engagement of retired nurses. Of course, this is not to block the succession or the growth and development of those who are there, but to provide the grandmothering and grandfathering that's required to help the system. So it's a cooperative and collaborative effort. But with respect to Ghana, I don't know if you've been paying attention with respect to what's been happening in the region. The Caribbean has basically taken a route to Africa, our motherland. And we have seen Nigeria, we've been to Morocco recently, Dr. Morton, myself, and Mrs. Maynard, the Director of Operations. We have seen where the Caribbean African Union have had several summits. And part of it, we've discovered that Africa, again, has quite a bit of resources. And these professionals who are coming on, because it's not just Ghana, we have some doctors and nurses coming from Nigeria. And those that are coming have years of experience, because they have to fit a certain criteria before they get here. And so we are benefiting from that resource. Africa is very big. If we take Europe, we take United States, you can fit it in Africa. Africa has a lot to offer. In fact, right now where the world is under stress again from births versus the number of deaths. In St. Kitts and Nevis, and other islands, you would have a challenge with respect to more births than deaths. We need more babies, all right? But in Africa, it is said about 2050, every 1 in 3 persons will be from Africa. So the birth rate, it hasn't slowed down, right? So, and of course, you have heard from, for example, the Premier of Nevis, who have said that in order for us to do better economically, sometimes we have to look at the population in terms of what we need to do, especially in small spaces.
So those doctors and nurses,
they come highly qualified, right? Specialized areas, and they come And there also is the onboarding, because part of the onboarding is making because we have had nurses, doctors from Cuba, Philippines, and so forth, and they work with us. The nationals have actually said to us, look, we enjoy the service these people give to us, right? So the onboarding and making them feel at home away from home, we have made that a very, very high focus in the Ministry of Health. And we'll continue to make sure that our African brothers and sisters receive the same cordial invitation and work with them.
The recruitment of these professionals, it is to fill a gap. It's not to replace anyone.
No. There's never replacement. Dr. Morton perhaps can answer that piece here.
We have. Pardon?
Go ahead, Doctor.
Sorry. We have.
Go ahead.
Yeah, go ahead.
We have quite a number of, we can consider them to be vacancies with regards to nursing. Or the best way to say it is that we actually have a shortage of nurses. It's a challenge that the nursing office itself, that would be the office of the matron, assistant matron, and the rest of the senior nurses in the nursing office, they deal with that challenge every day, trying to find the best ways to allocate the human resources that they have to ensure that adequate coverage is able to be provided. Normally, the challenge that emerges is that enough nursing staff is there, but in the event of a single person being unable to come to work for whatever reason, we're human beings and emergencies happen, it can cause a lot of chaos before we can, get it under control, just because the staffing is that tight. There's no excess, there's no room, there's no wiggle room, etc., etc. And apart from that, we are going to be recommissioning the private ward soon, and that's going to need an additional cadre of nurses to ensure that it also is manned 24/7. So the timing of the additional nurses coming, it's twofold. It's one, to address the current shortages that we may have, but it's also something that is going to allow us to be able to reopen and offer that service.
When are they expected?
The first set should be here close to the end of December. And another batch
28th.
will come in January, 28th of December.
28th of December.
Traditionally, we've seen nurses recruited from the Philippines. Does that impact the nurses' recruitment from other areas, such as the Philippines before, or
No.
are we moving specifically towards Africa?
No, it doesn't displace that. We will take it from where we can get it. That is in line with our protocol standards and our way of operations.
Yes,
because of course we have our uniqueness here as well that we have to make sure we pay attention to.
Yes, we currently have nurses from more than 12 different countries working. It's not just the Philippines. We have nurses from Guyana, from Jamaica, from St. Vincent, from Dominica, from Cuba, from the Dominican Republic. We have from Nigeria already that found their way to St. Kitts via their own means. So it's quite a number of different nations that we have staff members from.
But I'll also add that there's an agreement in the region that we do not poke from each other, because we all have the same issues in terms of shortage. So that is one of the reasons why so they too will find other Caribbean islands going beyond the borders of St. Kitts, beyond their borders to find nursing.
Dr. Morton, how do you envision the nurses from Ghana working alongside Kittitian and Division nurses and learning from each other?
Excuse me. Well, if I'm to draw from the example of what has been happening thus far with persons coming from the African continent that have been working on the wards, it seems to be going very well. The cultures actually have quite a bit of similarity, so the ability to adapt tends not to be that difficult. And we have groups of persons from those same countries in St. Kitts already, so they tend to find each other and they're able to be a little bit more comfortable when they are here. So I think it should be okay.
Okay. You mentioned, and I think we probably could jump to that area right now in terms of the private ward. You mentioned that it's going to be reopened. Tell us a bit about that.
All right, so the private ward is something that we've been working on for quite some time. It would have last seen activity around March 2022. That was around the time when the very last of the COVID patients that were being treated there, that's when things would have ceased. By the time And after that, the ward was essentially closed. By the time we would have come on stream, which would have been around September 2022, the ward was in a grave state of disrepair. And it was not in a condition that could have been accepting patients. So we had to do multiple rounds of deep cleaning, which was one thing. But the other thing was that the roof was not, the roof basically had lots of leaks throughout it, which was proving to cause even more difficulties with it being able to be kept up to standard. Thanks to cooperation with Taiwan, we were able to get the roof repaired, which was the first challenge or the first obstacle to overcome. After the roof repair, we were then able to systematically go throughout all of the rooms, etc. in the area, and we were able to upgrade all of the spaces. After that, we were able to get new modern furniture put into place, and now the only thing that's outstanding is the human resources aspect, which we are going to be putting in place in the next few days. And then following that, we will be able to reopen. We were trying to get it open. Ideally, it would have been good if we were able to get it open for like November to hit the cruise season, because that tends to cause an influx in patients that would need private care by their choice. But better in the middle of the season than after the season. So we're working on it right now. I have to give props to Mrs. Lindsay Maynard, the operations director, who's really been working on it bit by bit over the course of many months to ensure that this is done properly.
So the impact of having a private ward, because of course you just mentioned in terms of having additional patients. So spacing, you have now able to accommodate more patients. That's one. Yeah. What else would be the benefit of having a private ward?
Finances. Well, the private ward, it historically was one of the major sources of revenue for the hospital. And with the services now being able to be reoffered, it allows our own nation's Ministry of Finance to be able to gain back some of the income that it's been spending on healthcare via that ability to have those charges being meted in rooms of that type, in which the person actively chooses to go in rooms of that type to pay the fees of rooms of that type. So that's one thing. The other thing is some persons, local persons, they have also been requesting to get a private room. Without the private ward, the total private rooms that we have, it's not many. It's just about 2 per ward. It's about 2 to 6, depending on if you want fully private or semi-private. So it's not many, and if they're full, then there's no option except to go in the more open area. And that's one of the reasons why with the new hospital we leaned towards having as many single rooms as possible, because we've realized from persons' own indications that more and more people are trying to get individual rooms for the sake of their privacy, compared to in the past where that might not have been as strong a concern. So as the population has evolved with regards to their mindset, we're trying to meet the demand. But the private ward helps to address that, that demand.
And so will the rates be adjusted, as you just spoke to the fact that, it helps to contribute to offsetting the expenses that the government spends? Will the rates be adjusted?
Of course, let me answer that quickly, of course. Remember, what we've also done is we haven't put it back as it was. We have improved the aesthetics. If you go and you see the chairs, you may want one. They're really nice, very comfortable, a warm embrace and all of that. And so even the very towels, right? So that comes at a cost. But people like to know that they're treated, a certain way. Of course, the new hospital will bring even more of that. I mean, I often tell people the existing hospital, you get the best views when you're leaving. With the new hospital, you get the best views all the time. So, that is what it is. But certainly, we have had to review not just the pricing for private ward, but across the ministry to make sure that we're in alignment with what we're trying to do. At the end of the day, we have one hospital. We want to make sure that we are able to operate on a daily basis for our people.
Yes, but I just have to put in one thing, that even when we have the pricing reviews, we do not do anything to cause a barrier to persons' access to healthcare.
Correct.
Anything that we adjust with regards to pricing, it's going to be in aspects that are choice-based. So you'll have your option. If you want this one, this is the one that's either Well, sometimes it's free or sometimes it's relatively inexpensive, but if you wish to get this other option is available, but it comes at a cost. Right. So that's the way in which we've been moving. We can't have anything that's a full-blown barrier to your access. Or the most that we would do is we limit things that have a paywall to entry, and we would rather treat, and then if anything we bill you afterwards, and then come into the department and we'll discuss how we'll move forward with regards to the payment pad. But we always think it's important we're going to be changing up the way in which the bills look, because I think it's important for citizens to just see what is the actual cost of your healthcare. Because I think sometimes when persons see a bill, they don't realize that it's already subsidized. The government has already taken a good chunk out of what you're supposed to pay, and they just see that. But we'll actually be changing it so you could see this is the full price, and as a citizen, this is what you'll have to pay because this is how much the government's contributing. I think it will help them to appreciate it a bit more rather than having the notion of like this thing is, because sometimes, if you're very elderly or very young, you tend not to have to pay much of anything, depending on what you do.
Correct.
So sometimes they would just realize that the bill is nothing, but we'd still let you know, even though your bill is nothing, like you did healthcare that was worth like $2,000, just for you to know that it cost that. So I think it helps.
And one other point on that is that we always, in Ministry of Health, we always lag behind in cost and pricing, we always lag behind the private sector. Our cost is always lower than, regardless. But I want to make it absolutely clear that we are interested in ensuring that people receive the public health services that they should receive, regardless of their pocket or ability to pay.
And importantly, I should ask a question in terms of the standard of care at the private ward and also on the general ward. It won't be much different. You'll still get the same standard of care.
Yeah. Well, yes, of course.
Yes, you'll get the same standard of care. The changes, like I said, you're going to be in your own room. There's going to be packages with regards to, just amenities like towel, robe, those kind of stuff. You're going to have those things. The ability to have a television in your room, it's there because, have your own space. So it's not to say 3 other people are around you and you're playing something that nobody else wants to play, so you have more control. So those are the amenities that would be the only difference. But in terms of will you get a safe place to rest your head? Of course. Will you get a comfortable bed? Of course. Will you get the medication you're supposed to get? Of course. Will you get all of the treatments you're supposed to get? Yes. So the only changes are those changes with regards to the amenities.
Gentlemen, we are up against the clock. We're going to take off first and probably final break because, again, there's so much I want to cover. And this being, there are persons who are going to be coming back home and we'd like to let them know what's happening in the Ministry of Health and what they can expect when they come.
So you're going to give us 2 hours?
Well, I would say that, of course, we have responsibilities of our partner stations. So I don't think we negotiated for 2 hours at this time. But, of course, there's always that time to come back and update public.
We're happy to be here. We're happy to be here.
All right. So stay right there. We'll be right back with more In Focus.
If you haven't done it as yet, please do it today. Subscribe to our YouTube page at SKNIS Media for regular updates, live coverage, and even more information on your government. While you're at it, like, share, and interact with our Facebook and Instagram pages at SKNIS Media and SKNIS Info.
Welcome back to In Focus. We continue our discussions with Curtis Morton, the Permanent Secretary within the Ministry of Health, and Dr. Jenson Morton, the Director of Health Institutions. And we are talking about the strong pulse that is taking place within the Ministry of Health. And you mentioned the smart hospital several times. And before I get to that, I want to stick with our discussion on the current structure. JNF is, of course, has been much talked about by the Prime Minister. The introduction of MRI services and a new facility had to be constructed for that. Basically remind us why the new facility, the new building was necessary, and where are we with that?
All right. So one of the things that we've been trying to improve and modernize at the hospital is everything regarding diagnostic services. And the main component of that is radiological imaging. So if you would be focused on, or if you focus on what the Prime Minister has been systematically doing, you'd realize that we started with the upgrading of the X-ray unit to be able to do fluoroscopy studies. Then further to that, we had the addition of the CT scan machine, the 128-slice CT scan machine, state-of-the-art Philips CT scan machine. Now, apart from those two devices assisting, another one that was absolutely necessary for persons to get the information that they would absolutely need in order to make the best diagnoses would be MRI services. Now, one of the pluses of MRIs is that MRIs are not an emergency, they're not an emergency imaging service. It's not like a CT scan in which you need an emergency CT scan. So it's something that can be booked and it's something that can be planned, but it is something that gives lots of information that can help different doctors to be able to treat accurately what they're going to be treating. Now, in the past, St. Kitts did not have any MRI at all. And when persons needed those services, they had to travel to either St. Martin or Antigua. And that would have been a long time ago. About 10 or 9 years ago, that was when the nation was able to benefit from MRI services being offered at the research facility in Borio. They were dual purpose in terms of it was needed for the research that they were doing, but it also was a normal machine which human beings themselves could also use. So the services were there, and that was the only source of MRI imaging. Since I have to say that Dr. Clark has a private MRI facility in Bastia now, so at least we have multiple options now. But on the government side of things, we also recognize that persons still would need the ability to access MRI imaging because, of course, we're always trying to ensure that barriers to access are just not there with regards to the general public getting what they need to get their to get everything that they need for their services. Now, even though we are commissioning a new hospital, thanks to MRIs not being emergency procedures, it allows an MRI facility to be placed anywhere. So it does not absolutely have to be in the hospital. It's best if it's close to the hospital, but it does not have to be a part of the building or on the absolute grounds of the hospital. So that gave us the freedom to look at the current hospital grounds that we have and to actually put the MRI facility in place there right away. Since the Ministry of Health is still going to be controlling the space and the new hospital is coming on stream, it meant we did not have to wait until the new hospital was done to be able to have MRI services available to the general public. So the space was identified, the research was done, and the building was constructed. That building is an expensive type of building because you have to make sure it has the correct components with regards to everything from the electrical load to the shielding to the magnet fields, limitations being taken into consideration. So it's a lot of research that had to go in it. So it actually is quite a sizable investment, separate and apart from the machine itself. The machine itself is coming to St. Kitts within the next few days, actually. But the room had to meet specific stipulations before we could even get into the path of having the machine here, even though the machine was paid for quite some time ago. So when that service is up and running, it's going to be the first time that the government of St. Kitts and Nevis has an MRI machine, and the first time that those services are available in the government service for St. Kitts and Nevis. So it's going to be quite a milestone and quite an achievement.
So the building is essentially finished? Where is the status of the building?
The building is finished. It's quite a few partners had to come through for the building to be finished. Apart from the contractor himself, SKNIS also played a very pivotal role because of the changes to the entire electrical system that had to take place. And, you know, they came, they put up the, I don't even know these things, the transformer, the big transformer, excuse me. They dug the trenches for all their wires, and they've done all of that. The experts are going to be on island on the 8th to do the absolute final checks to make sure that everything is in place such that it's safe for them to ship the machine, because that machine is a type in which it can't stay idle at the ports. From the time it comes, it has to be shipped right into its place. So everything has to be ready to accept it. And then when it comes, you seal it off, and then you prepare the internal part of the room for the final part. Then you commission the machine, train the staff on the machine, and then everything's good to go. So we're looking towards hopefully getting it up and running by the end of the first quarter of 2026.
Okay, that was going to be my next question.
Okay.
When can we expect the services to come online?
No problem.
Will that also include an additional staffing, persons to
Yes.
operate the machine?
Yes.
Yes, so two things are taking place. For one, I have to thank the Ministry of Finance because they have understood the request which we made, and they've allowed us to have space for the employment of an MRI, of a specific MRI technician. And we do have an application that has the necessary qualifications to do that role. But that's just one. All of our radiographer staff, we have 7 radiographers on staff currently, all of them have expressed interest in training in MRI. All of them come with training in MRI, but they've expressed interest in getting the specific training for the specific machine that we're going to be incorporating. So working with partners in Taiwan, we intend to send them to get the training one by one on site in Taiwan, and then when they come back, they'll serve as additional persons that can ensure that the machinery is able to be operated.
There's also work being done at the back of the hospital, and that would be the expansion of the morgue.
Yes.
Give us the latest on that.
Okay, so if one went to the back of the hospital, one would see the oldest part of the hospital, the part that was built since 1966. So persons that, if you ever used the hospital before around 2001, so persons that are in that age bracket
That's me.
to remember
1966, that's me.
that, they would remember the old parts of the hospital and which was what component. So in the back part of the hospital, along that old wing, which was damaged since 1989, the morgue still rests there. Now, some of the areas adjacent to the current morgue, they have not been in a good state for quite some time. Since they lost their roofing from hurricanes, no attention has really been paid to some of those parts. Some of the usable parts, they've been turned into other parts of the hospital system that we've been using, but between the morgue and the laundry area, it's just this gap without any real roofing, and it's just walls. So originally, the intention was just to knock down the area. But when some experts were brought in, I was surprised. I'm not a construction person, so sometimes when something looks bad, I tend to write it off, and they actually said, it's actually not that bad. It just needs roofing and a little bit of work. Surprising, but that's what the advice was. So seeing as that was the case, we decided that, and also have to bear in mind that the current morgue that we have, it needs an upgrade. We had a situation where a boat filled with about 21 deceased individuals. They came ashore, and every single one of those bodies needed to be autopsied. And we had to bring in experts from overseas to help our local staff. And the rate limiting step was the fact that we have this entire country with one morgue room with one operating bed, and it really restricted. And when persons presented the research, they said that for our size, it's really too small compared to what we ideally should be having, because it means that we have 2 pathologists, for example, but only have 1 bed. So I'm limited with the infrastructure that is there. So since it's directly adjacent, we did say that we were going to invest in expanding the morgue. So the morgue is, again, a component of the health system that's actually going to remain in the current JNF structure. So that allows us to invest in that area without any wastage of finances, because this is going to be a long-term feature of the health system. So we are working on that. And also, of course, it will help the scenery as you're going towards the MRI facility to be more pleasant. You don't have to see anything dilapidated along the way. So it also helps. And, you know, we've been trying to get certain things, like the PS would have expressed concern when he would have noticed that when persons that have to come for an autopsy, the family members, that they have to stay outside, or they speak, and if it's raining, they have to go in a corridor. There isn't even a proper waiting room. So an area was already cleared that had roofing, that was already cleared such that that could happen. But we're going to fix up the entire place properly in the upcoming months. It also was expressed as a desire from the Prime Minister himself to get it fixed up. I should also note, he calls about it all the time, so yes.
Right, and that also will help with, of course, the dignity of the dead, and also when there is examinations that need to be done, especially when it comes to criminal cases, that makes it more secure that persons will be able to more or less rely on information and the data and whatever scientific analysis is getting received.
You're correct. You're correct.
Right. Okay. All right. So let's move on. Let's move on to the Smart Hospital. Now, the last time both of you were here, that was in February 2025, and I think the plans were basically unveiled, and persons were very excited to finally get a better understanding, of course, by seeing the architectural designs and so of what would be presented. Since then, there has been delays. What's taking place?
It's not a delay.
It's not delays. Not delays. Let me speak to that, because and then I'll let Dr. Morton come in. And I say I speak to that because Dr. Morton has been very instrumental in the data work that went into the design, because the design and build hospital. And so there are a number of factors and a number of things that we had to take into consideration. For example, we had an environmental impact assessment. We also had borehole testing. We have to test the density and depth of the soil and all of that. We also had to check to make sure that the water lines and all these other things. And the design and build, you have to make sure that you have the proper protocols, proper building designs and so forth. So the Development and Control Planning Board was the one responsible. Now remember, we have for the project, we have the OECC, who is the contractor assigned to build a hospital, and with some other subcontractors. And I can tell you that yesterday, I actually received from the Development and Planning Board all of the drawings, physical prints.
I think you should insert the picture of them in your office.
Right, I took a picture of them. Some big, they can't hold it.
Takes up a room.
Takes up a lot of space. But that's the final approval. These projects take a lot of time, a lot of negotiations, because even the work that Dr. Morton did with making sure that there are certain features and benefits available to. I'll tell you how important the impact of what has been done. We went to Cabinet to make a presentation on what the content of the hospital. They had a schedule, I think, for about 35 minutes or 45 minutes. We spent 2.5 hours. And Dr. Morton made a presentation, questions, and they were so excited about it. And so that is the part I want Dr. Morton to just share quickly, because now we're pressed for time, to share quickly some of the salient features that we have coming out of that new hospital. Okay. So Dr. Morton?
Okay, well, yes. So the new hospital, it's going to be specifically built and tailored for the population of St. Kitts and Nevis. So everything that's being done with regards to the new hospital, these are the final things that, from our analysis, that we think cannot be achieved at the current JNF site. Of course, we try to maximize what we could do at the current JNF site, but there are certain limitations that came about that were due to the infrastructure of the area. So this gives us an ability to offer a lot more to the citizens of St. Kitts and Nevis with regards to the level of healthcare standards that are in line with international standards. The first thing is that the facility is going to be a 128-bedded facility. Now, some persons would see that if you research it, you say the current hospital is 164, so if you're going to 128, isn't that a step down? It's actually not. If one is to look at the tallies at the end of the day for the inpatients of the hospital, it's usually juggling around 70. And even when the hospital was first being rebuilt in 2001, the recommended amount of beds was actually 120. It shot up to 164 just because of a few things happen here and there which made people say that, okay, let's err for safety and go up to 164, and it's proven to not be necessary. What makes it difficult is the distribution or the allocation of the beds. So how the facility has been designed is designed in a manner such that it doesn't have the restriction of this specific ward or this specific type of patient only in this area, and it's a lot more overlap that is allowed so that we can occupy as much of the spaces as possible in a level of maximum efficiency. Also, which I would have mentioned earlier, maximum single room. So what that means is that when we are all long and gone, 50, 60 years in the future, when the structure is still standing, if there is ever any other pandemic event, nobody has to bend over backwards to try to make any kind of shifts or adjustments. The facility, they'll be able to see that the facility has been specifically built to be able to be used for in such a crisis if it were to occur. We've been able to expand the spacing offered in particular areas where persons would have had some complaints, and we're also focusing on 3 particular centers of excellence in the immediate term. We're focusing on oncology, on cardiology, and on everything to do with nephrology, meaning our cancer patients, our kidney disease patients, and our heart disease patients. Those are the 3 main centers of excellence that we are going to be focusing on as requested by the Prime Minister. And as time goes on, we are going to be expanding the centers of excellence that are offered in the facility. The facility will have expanded outpatient services much more than the capabilities of what we have right now, expanded emergency room services, expanded operating room services. We're going to double the amount of operating theater spaces. Instead of 2, they're going to be 4 full-time operating theater spaces, as well as the ability for spaces in the emergency room itself to be able to be converted into an additional operating theater, because it's going to meet the sterility requirements. We also looked at the arrangement and spacing of the areas. So the operating room is directly adjacent to your emergency room. There's no hallway to pass through. It's one and it's directly to the other, so it allows for the easy streaming of someone in need of an emergency surgery. Similarly, the emergency room is directly adjacent, again, on the other side to the radiology department. So if you need an emergency X-ray or imaging, it's immediate, no need to pass through any kind of hallway. It's a multi-tiered design, so that means that it's minimal amount of walking in terms of lateral, because elevators can take you from one level to another to decrease the total amount of actual walking that you would have to do. It also allows for increased sterility, because now with the operating theater being on one level, the sterility department is directly beneath it, so you can sterilize things and then send them up to the theater and send them down. No need to walk through any kind of areas to get something back and forth. Maximizes the view, because everyone knows that views and landscapes, they assist with the rate of healing. So now with this location, all of the areas that have patient rooms are on the higher levels, such that you can get a nice vista from any of the rooms that you'll be occupying. You'll be able to get a nice view. So that's something that was taken strongly into consideration. Its ability to withstand a long list of natural disasters, such that the hospital, even though it looks very nice, it can provide the functions of an emergency shelter, part 1. But apart from that, the general public can rest assured that nearly regardless of the emergency that hits St. Kitts, that the hospital will be one of the last buildings standing, because of the level of investment in the infrastructural stability that we are taking into consideration. And of course, in terms of green energy, the ability for water harvesting, water recycling, the ability to reduce the overall electrical consumption based on the design of the maximum natural lighting utilization and other aspects. The list goes on and on. It's quite a number of things were taken into consideration to ensure that this project is a successful one, and that we didn't really leave any stone unturned to ensure that as many things as possible that we put in this hospital. Maybe a future generation, we're not perfect. If they have to adjust something, they got to at least look back and say, okay, we can appreciate the amount of work that went into it, and we're going to try to keep it up at that standard.
But that point that you made about it being able to withstand natural disasters of significant impact, of course, we recall the devastation in Jamaica from Hurricane Melissa, Category 5 hurricanes. And as I spoke to the Prime Minister on the fireside chat during the budget consultation at the Marriott, we see that Category 5 hurricanes are basically, they're not the exception anymore. They're developing every now and again. And the change happens overnight. You would hear about a tropical system, maybe, and then it's upgraded to Category 1, and then overnight, sometimes 2 days, it's already a Category 5. That's very important to have this facility being able to withstand a Category 5 hurricane at least, because, like I said, they are no longer the rarity. They're coming the exception. And of course, we pray against any major strike against St. Kitts and Nevis of such. But the government's job and our job as people are to be prepared.
Yes.
I agree.
Okay. So can you tell us a bit then, based on what you would have said in terms of plans being approved? And I know I wouldn't necessarily want to tie you down to a timeline, because there's still a number of factors that have to be taken into account, especially when it comes to the contractors and building materials and all of that sorts. But when can
you're forgetting one factor.
What's that? Tell me.
a hard-working Minister of Health, Prime Minister. He doesn't sleep. He has already put together a task force. We had our meeting yesterday, and that's why I can tell you that we will be not only turning the soil, we're putting on the cornerstone before the year ends.
Before the 2025 ends?
Before 2025 ends. We're putting on the cornerstone.
Okay.
All right?
All right. And so something as that the Prime Minister, Dr. Morton, and with just about 6 minutes left, just under 5 I should say, that he's been very passionate about was the St. Peter's Polyclinic, because of course St. Peter's is the fastest growing center in terms of in St. Kitts and Nevis in terms of population. Tell us a bit about the clinic, because of course it started and then it had to be paused as well. So tell us what's happening there.
Okay, so the Polyclinic in St. Peter's is a project that's dear to the Prime Minister's heart that he wants to really see finished, but not just finished, done properly. There was an original plan for St. Peter's to just get a new health center, essentially. But, you know, from the advice of the Prime Minister, because of the population of the area and its uniqueness with regards to its location, and I don't want to say isolation, it's not really isolated, but it's kind of a large amount of people that are separate from the wider St. Kitts, if you think of the Island Main Road. So it was his desire for it to be on another level and to actually be a polyclinic with multiple services, meaning for it to have a pharmacy component. It would be the first pharmacy in St. Peter's. For it to have a mini lab component to again be the first lab services in St. Peter's, and for it to have a dental component, for it to be the first dental office in St. Peter's, all under the same roof as a one-stop shop. It's also going to serve as a semi-ambulance depot, not 24-hour ambulance station, but as a place where persons know that if they have something urgently, that between particular hours they can travel right there and that they can get either dealt with or chauffeured accordingly. It's also going to have the regular health center services with some expansion of those services. So all of that is planned. The expansion on the original plans that were there, that's already been done, it's been discussed. There were some delays from contractor side, but that's been, for the most part, resolved. And the final part of it was just to agree upon some of the aspects of the expansion of the plans.
And the designs have been completed, actually.
I think that's been complete, right? Yes, so that has been completed. So now they can move forward with the finalizing of the St. Peter's Polyclinic as well. And we are trying to see from the pilot of St. Peter's project how many areas we can transform into the polyclinic type of model instead of the health center model. So the health center model's plus is that you have lots of small facilities and the accessibility factor is increased. But when you have that many small facilities, it's difficult to have many of them have the full list of services that a full polyclinic can offer. With the polyclinic setting, it allows for you to have all of the services under one roof, and it would just be to improve your transportation network such that no one is negatively impacted. So even if it is that you had 3 health centers that were small in an area, and then you instead get one solid polyclinic, it would be for there to have a good transportation network. So persons that were accustomed to going there, you can easily go to this one, but the plus is that, you know, a physician is always there, the pharmacy is right there, dental services, everything that you need is right there, and that's the model that we're going to. So with St. Peter's, if the project with St. Peter's proves to be successful and the numbers are able to back it up, that's when we can start the discussion with the different communities if they're interested in having the shift to the polyclinic model, or if they still prefer the older health center model. And we'll see as we go along.
Yes.
And where do you lean?
Pardon?
Where do you lean?
I prefer polyclinics, but at the same time, I have to ask the persons that utilize the service. So even though I'm looking at it from the outside saying, instead of having 11 health centers, we can have like 4 or 5 polyclinics that do everything, and it's just to have buses going back and forth to help older people. I don't know if they would say, I'm accustomed to walk into my health center, I just want to continue walking to my health center. So it's up to them.
Yeah.
at the end of the day.
We'll find out.
Right.
Yeah.
Okay. So, P.S., I know that you recently would have welcomed a new public relations officer, and
Right.
the ministry has been doing a lot more to keep the public informed. I'm going to give you a quick second to plug one of the latest initiatives. Well, I wouldn't say it's necessarily the latest. It's a quarterly thing.
Well, it's actually the cameraman. Cameraman, you have this? Right. This is our third edition of our health cycle newsletter. It's online. It's on the social media platform, including our Facebook page. It will be shared also on SKNIS. We are featuring Mr. Glenville Leader, who works in our community services. And of course, next quarter, we'll feature someone else. But if I may very, very quickly, I just want to thank you for the time that you've given us, and to let the public know that we'll continue this engagement in the new year. It'll be more frequent because we have a lot to share.
All right.
Yeah.
So I'd like to thank you and Dr. Morton for joining us for this edition of InFocus. And as I mentioned at the top, it was our final edition for 2025, and so I think certainly the public would be grateful for the information that was shared. And of course, we look forward to hearing a lot more in 2026 about the continued improvements in healthcare. Of course, the ministry continues to work, the government continues to upgrade, because as the Prime Minister often says, all we have is our people.
Correct.
And we have to ensure that our people are trained and educated properly, but we also have to make sure that our people are healthy. So, gentlemen, thank you so much for joining us for this edition.
Thank you very much. Merry Christmas, Happy New Year.
To you as well, and also to our viewers and listeners. We are grateful that you would have joined us for either this episode or other episodes throughout 2025. We certainly look forward to welcoming you back in 2026 if it is the Lord's will. Until then, we would like to wish you a safe season, whether you are celebrating Christmas or Carnival or whatever other activities you may be engaging in, whether at home or abroad. We would wish you all the best, and we hope to see you again in the new year. For now, I'm Ian Richards. Thank you so much for joining us.
Join us every Wednesday for InFocus, a weekly talk show produced by the St. Kitts Nevis Information Service, where we provide exclusives with key persons within the government and discuss pertinent, relevant, and interesting matters that affect us all. Tune in every Wednesday, live on ZIZ Radio and streamed live on Facebook at SKNIS Media and ZIZ Online. InFocus, your government, your business.